Hello, this is Andrene Thompson, and this is my reflection two for social justice analysis assignment, and this is for PC 729. And I am responding to Team Sycamore's analysis presentation, and their topic is EPT, which is expedited partner therapy, which again was new definition for me. Dash solution to help disparities among young female adults, among young female in Florida. And so again, I am responding to these questions that were reflected, and I will say before I start my reflection, this was a great presentation. I actually loved it. I love the slides. They weren't wordy, and you guys were not reading from them. So I love that. I love the graphics, and it was a very clean presentation. And yes, I did watch it in its entirety, and I actually watched both the ones that I selected, and I'm actually happy I did because, and the only reason why I watched it because the information was good, and I was like, wow, wow, I didn't know all this. So, Doctor Baker, I'm not trying to do brownie points or anything, but I think these topics are really, really good. I've learned a lot from both of them. So for this particular topic with the expedited partner therapy, um, so on my reflection, so I will address the first question. So what did you learn in this presentation that changed you? And I will go back to my clinical experience because I haven't started working as a nurse practitioner as yet. I think I became a nurse practitioner last May or April or somewhere around there. And I went straight into the program, the DNP program. So I really haven't started practicing as yet. But I've actually learned a lot because during my clinical rotation, and I've been at this clinic probably for close to 2 years because I did some DNP clinical there also in addition to my MSN clinical, and I did not know about this expedited partner therapy. So I actually went on Oklahoma website and health authority and find out if we actually have a policy, and we do. And I will get into that later on in the presentation. But but definitely what I've learned that would changed me. Uh, when I was in my clinical rotation, I was again very frank with these young ladies because I probably saw maybe two male patients. That's just who I saw that actually came in to get tested or, are having concern that they may have a STI. And I've seen a lot of female patients. So with that said, I've actually learned a lot because if I had known, because usually what we would say to them is you need to have your partner come in and get tested, or we would say to them they need to abstain from sexual activity for X amount of time, and their partner also need to get treated. I guess what I'm trying to get at is I didn't know we could actually give them the script and say, "Hey, this is for your partner," and based on this policy that I looked at Oklahoma website, this is for your partner, this is for you. Abstain from sex, and you guys need to take these medication. So yeah, for sure. If had I known, this will definitely change the way I practice in the future if I ever practice with this type of patient population, because I think most of the time, if they can get the medication without seeing a provider, I think they will take the medication. Sometimes it's just hard, because of embarrassment, and and for whatever reason they don't have insurance. They don't want to come in, and they probably feel like their body will get rid of it when they really need to get treated, because again, the long host of complication, especially for the females. So definitely hearing about this expedited partner or therapy and doing my little bit of research on it definitely will change the way will change the way I practice in the future. And how the other question is, how does an idea in the presentation give you an idea for a potential role for you as a leader in your profession in terms of advocacy or social justice? Again, I will take the advocacy approach, but I think I'm going to hold on and respond to that question when I am responding to number two on this assignment. So let's talk about the. I'm going to move on and talk about the new content. So what did I find the new content? So I actually did my research, and of course I tend to look at stuff that affect Oklahoma because since this is where I live, and so I found this graph on the CDC website, and it actually is in line what Sycamore presented in their presentation in terms of age. On this graph with and see, chlamydia is way more rampant. Chlamydia is way more rampant than gonorrhea. I mean, more patient test positive. But this is chlamydia and gonorrhea among women by age group, and this Oklahoma in 2015. And so for ages 0 to 14, it was uh, very low. They only had, it's a bar graph, so they didn't put a number at that, but it's very low. However, for ages 15 to 19 years for chlamydia, it was probably about 4,500, 4,500 that tested positive in 2015. And then for gonorrhea, it was less than 1,000. And then still in 2015, and for ages 20 through 24, this age group had the most. They were at 6,000. They tested 6,000 cases of chlamydia and about close to 2,000 cases of gonorrhea. So clearly in Oklahoma in 2015, where more patients were testing positive for chlamydia than gonorrhea. But it seems like our I know in the presentation they look at adolescent, but it seems like our young adults 22 24 has a higher rate than our adolescents in Oklahoma when compared to what was presented in Florida. And so another new content that I found is this policy, and it was actually reviewed in January 2018, and it's an Oklahoma policy, and it's titled Expedited Partner Therapy. And of course, they have the definition: expedited partner therapy is the clinical practice of treating the sex partners of clients diagnosed with chlamydia or gonorrhea by providing prescription or medication to the client to take to his or her partner. So that's what I like about this, without a healthcare provider first examining the partner. So I like that because I feel like with this practice we can probably control it to some extent, because I feel like a lot of the males, they don't want to come in because of the whole embarrassment and thing, but I think if they get the medication they will take it. So I definitely like that in the definition. And then I scroll down on the policy, and the policy is about 3 or 4 pages. And then I like the part where it says it has issues. It has section where it's EPTD is not recommended or issued to, like, men that have sex with other men, clients whose partners have confirmed allergy to the penicillin, and clients with STD associated syndrome like PID. So they have that built into the policy also. Are clients who do not have a lab confirmed diagnosis of gonorrhea or chlamydia. So definitely the male or the female, whoever came in, they have to have a confirmed diagnosis before this treatment is given to them for their partner. And they on the policy they have definitely the recommended treatments, and it has information about the client education, and the education include information about the medication, and then the counsel client regarding EPT, and encourage client to notify recent partner to seek evaluation and testing, and obtain name and contact information of partners from client and offer EPT. So yes, and as I said, this policy is it's actually 2 pages, sorry. And it's very informative. So I'm happy this is out there. So I'm gonna save it, and one day I'm gonna ask my preceptor, and she probably knows about it, but I didn't. I'm gonna email it to her and say, hey, did you know that this exists? Because I think it will help. And it's an Oklahoma policy because I think it will definitely help some of the patients that we see in the clinic. Because we do see quite a few patients that actually get tested for chlamydia and or gonorrhea. And so moving on to question number 2. So it said use one of the following questions to guide your response. And then the question that I will answer, which is similar to the one that I said I will respond to in this section. As a social justice leader, how does the content of this analysis shape the way you communicate with others? Um, Honestly, when it comes to STI and young adults, I this will only help me in terms of knowing that I can freely give them the additional medication. But I've always been like very strict with these young adults when they come in and they're having unprotected sex, or if they're just sexually active at all. I was kind of like the bold person that kind of tell them, make sure you're using protection, make sure you're this, make sure you're that. So yes, so definitely. So this is again good information that I can gear towards this patient. But in all honesty, I really, when I was during my clinical rotation, I really probably didn't focus a lot on the adolescents because they're probably always with their parents. So it's usually I usually don't talk to them about being sexually active, and unless it's brought up, or if I'm doing an annual wellness. So now with this planted in my head, for sure I need to know that this is something I need to discuss with these age group, and somehow I'm gonna have to devise a way how to get this to discuss this information with them, because they're probably not going to be forthcoming in front of their parents. So yeah, so it's just gonna have to be strategies that I think I will develop over time. And in terms of whether advocacy, social justice, and the disparities, I think again, I like to be on the side of advocacy, and I tend to more gear my thought process towards developing policies that they can use in clinics. So maybe there is a EPT policy out there, but I'm trying to wonder how many of these other small clinics probably know that this policy exists, because throughout my rotation, I didn't know that this policy exists. So maybe I could, again, I'd like to say that I will join the association, which I do plan on doing, because I honestly feel like I want to get into advocacy, because I feel like I can make a difference and speak up, because clearly I'm in the minority group. Yes, I do have an accent, so I don't sound like them, but I feel like people will listen when they see some similarities, or we have maybe some similar experiences, and so they will listen to what we have to say, and probably even maybe trust us more. I don't know. I'm just saying, probably because I look like them, they may tend to listen more. These yeah, I kind of went off on the African Americans because I know they have a high rate also of sexual transmitted disease. I think back then I did look at herpes, and like 40% of the African American population uh, are tested positive for herpes. So while I didn't know about the whole adolescence part, I did know that African American for sure has issues with herpes, especially in Oklahoma. And so yeah, so back to the question, how would I communicate with others? So it's more like, yeah, I'm grateful I found this policy, so I'll see how, if I could share it, um, how I could share it with the other clinics, that and see if they're all aware that this policy exists. Because as I said, based on my experience, it seems like a lot of the partners, especially the males, they don't want to come in and get tested, fear of embarrassment, or probably they may not have any symptoms, and maybe it's only the females that have symptoms. So for sure, That's kind of how I would try and communicate this information to others. In addition to, if I see a patient within the age group, sexual active, I talk to them about it. And if they feel like they need to get tested, I definitely would encourage them to do so because, of course, of the complication that can ensue. So I want to thank Team Sycamore for this great presentation. And it was definitely enlightening. And as I said, I love both presentation. I love you guys' slides. It wasn't wordy, and you did not read word for word, so that was great. Kudos, and you answered all the questions. So thank you.